Okay, we're going to get started. So, hi everyone. Welcome to today's webinar, Interviews with Hamilton County Safe Service or Syringe Service Program Participants, Observations from the Field. My name is Melanie Gibney, and on behalf of Hamilton County Public Health in Cincinnati, Ohio, and the Harm Reduction Division team, I'd like to thank you for joining us today. So during this webinar, all participants will be in listen-only mode. And at any time during the presentation, you can enter questions in the chat box, and questions will be addressed at the end of the presentations. And if we don't get to them all, we can follow up via email. A recording of the webinar and the slides will be sent afterwards along with a webinar survey. And if you experience any technical difficulties, feel free to message me directly or Phil Graham. He'll help us with any technical issues. So here is today's agenda. So first we'll do the welcome and the overview and introductions of our great speakers from the Harm Reduction Division. And then we'll hear from 3 Harm Reduction team members, and then we'll have an open discussion and questions at the end. So by the end of today's webinar, we hope that you all will be able to describe Safe Services participant opinions and their ways to increase the safety of illicit drug use within your community, demonstrate the need for continued education to promote the best outcomes with the use of naloxone, and examine the impact of stigma from the person using drugs, perspective. So first you'll hear from Shauna Merrick, who is the Harm Reduction Division Director. She received a bachelor's and a master's degree from the University of Cincinnati. She's a licensed social worker, a master's certificate in contract management from George Washington University and ESI International. She has a CDCA and has also been working in the field as a licensed social worker for over 30 years. So she practices trauma-informed care, and she has been fortunate enough to have received treatment as a young adult, and then allowed her to pursue a meaningful career as our director today. Then you'll hear from Destiny Randall. She's the outreach coordinator at Hamilton County Public Health. She received her BA in criminal justice from University of Cincinnati. Prior to joining the Harm Reduction Division at Hamilton County, she worked in the MOUD program at Community Medical Services as a substance use disorder counselor. She's also experienced with clients with mental health issues and incarceration. Destiny is currently working on various projects, including the naloxone distribution, harm reduction subcommittee, and systems coordination. And finally, you'll hear from Darcy Smith. She is the Senior Community Outreach Coordinator at Hamilton County Public Health. She received her BA and MA in Sociology from the University of Cincinnati. Prior to joining the Harm Reduction team, she worked in Children's Services at Hamilton County Job and Family Services. Darcy is currently leading a team of community outreach coordinators working on various projects, including naloxone education and distribution, systems coordination, and fentanyl test strip distribution. And with that, I will turn it over to Shauna Merrick.
Hi, good afternoon. Welcome to everyone. I just wanted to give some brief overviews about kind of what took us to why do we conduct the survey? How does it, how does our work fit into kind of the framework of the work that's going on in our community? I would like to start with Safe Services. So we did change our name. So we were formerly a syringe service program known as an SSP. And then as we looked at data and we looked at hotspots and we gathered more information, that we saw, like many across the country, pretty significant increases of overdose for people of color. Illicit fentanyl being in nearly all illicit drugs that are marketed on the street. So syringe service, we have a mobile syringe service program. However, we wanted to change our name to S.A.F.E Services so that we're sure that anyone that would need our harm reduction services would feel welcome to come. And I think S.A.F.E is an acronym for stigma-free access for everyone. And so we're still working on that effort, that it's still predominantly seen as a syringe service program. But we are messaging and outreaching because we want anyone who may have need for naloxone, fentanyl test strips, testing for HIV or Hep C to feel welcome to our mobile services. So that's kind of where our name change came from. In terms of the framework of our community work and what we're doing, we are part of, in our county, we have what's called the Addiction Response Coalition, the Hamilton County Addiction Response Coalition. And in this coalition, so it's spearheaded by our county administration. And underneath that, there are I think there are 6 subcommittees. Business subcommittee, interdiction, treatment, prevention, faith-based, and then harm reduction subcommittee. And as part of that, I know it got all squished here, but in terms of the slide, so I mean, our very particular mission and vision is around our harm reduction work. And so, creating a collaborative network of harm reduction service providers that supports the health and well-being of individuals, families, and communities. That's our mission. And that's kind of where it fits into the work of our S.A.F.E services. So is it okay to go to the next slide? I'm not sure. Okay. Why did we do this? So why did we conduct a survey? Honestly, this had been on the radar for a very long time for our division. Just because we wanted a qualitative method. So we were looking, because we track a lot of our quantitative data, right? Like how many participants we have like the races of participants, how many client services per month. So we have all of that good data, but we really wanted to know, are we meeting the needs of the participants that come to our services? And if we are meeting those needs, great, then it reinforces the work that we're doing and what could we do more of? But if we aren't meeting the needs, are there opportunities for us to do better or to engage other partners? And so that's really how this all came about. We were in a partnership meeting with other counties. And so the base of the survey was actually constructed by a harm reduction partner in Butler County. And then we are also working with a consultant and more consulting who helped us in terms of all the technical pieces, all the logistics, like with the survey questions themselves, that we ensured that we had script and training for each of our interviewers so that we were conducting this in a way that would give us the best kind of source of information that we could have. We were using our methodology was that we would go to every site. We conducted 148 interviews. So we had 5 sites for which we went to. One of the things, because of our approach in wanting good qualitative data, is that we didn't want to rush any interviews. We didn't want anyone to feel and we didn't want it to be a checkbox. I mean, we just wanted meaningful conversations. And what I thought, and I know that Destiny and Darcy will talk about this more, what I thought was so interesting is that our harm reduction staff have created such a safe, welcoming environment that people were eager to share. And we only wanted to conduct 5 surveys at a time at each site. So again, we weren't trying to be in a rush. We were really trying to make sure that we spent meaningful time with folks to really get some good information and ask some probing questions, and give them the opportunity to ask us probing questions. The dates of the interview were conducted over 4 weeks, so May 9th through June 8th. The interviews and average length was 17 minutes, and we did provide an incentive for participants. Now, I have to say the first week, maybe 2 weeks, but I'll let Destiny and Darcy give better framework to this. So we had the incentive, but it was not our lead off. the lead off was really, will you be interested in sharing your opinions with us? And that providing the incentive came at the end of the survey. I mean, at the end of that survey. And so it, and it, so it just said to me that people were eager to share. People were eager to, that they were happy that they were being included in terms of, asking whether or not we're doing good work, and how, and if we're doing that good work, what does it look like, and where could we do better? So I think that this really gave us some very rich qualitative data to look at, and how we can manage our services, and how we're using that data moving forward. And now I will turn it over to Destiny.
Okay, so what I did every day was I had an Excel spreadsheet, and my goal was to try to get as many men and women as possible, but I also wanted it to be like equally. So every day I would send out an email to our staff to keep track of how many male and women we had each day, to try to keep an even number. I will also keep track of race and ethnicity. So we were able to try to target every race. And like Shanna had said earlier, people were eagerly willing to take a survey. I just remember like my first week, I would just ask people like, hey, would you like to take this survey? I told them what it was about, and they were like, sure. And after the survey, I put out a gift card, and they were like, really? I wasn't expecting that. And so the fact that they were able to share with me, and I was open, and they can tell that I care, and they were able to give me information, it turned out really great for me. You can go to the next slide for me, Melanie. Okay. So like Shanna said, we have 5 different sites, which are Coreyville, Northside, Over the Ryan, Walnut Hills, and Western Hills. The 2 sites that are open later are Walnut Hills and Western Hills. We actually just did a little bit of switch with that. Walnut Hills is now open from 4 p.m. to 8 on that site. And then, I'm sorry, that's Western Hills. And then Caracal site is open from 4 to 7. And so we just did that. We did one site when we first started the survey. We just did one site each week just to see how it would go. And then that's when we did 5 surveys each week. We just started our Walnut Hills not too long ago, so that's why you don't see as many surveys with Walnut Hills as the rest of them, just because it's not a lot of people that were coming there. And so we had to get surveys from the other locations. And a lot of our clients actually live in the Western Hill / Price Hill area based off the zip code. And so a lot of our surveys came from that site. You can go to the next slide. So 97% of our clients have the tools to use drugs safely. They were just grateful that we were giving them the tools that they needed, and that they can come to the site more than once. And with this survey, what we realized is that some people want shorts and longs. They didn't understand why we didn't have a mixture. So that was one change that we made. So now if you go to one of our sites, you can have half short, half long, instead of just doing just shorts and longs. And now I'm going to turn it over to Darcy Smith.
Right, you can go to the next slide, Melanie. So we also asked our participants how they could increase safety, and our number one mention, we had a lot of open-ended questions. So we just kind of left it up to them to tell us. And the number one mention was to stop using. And we really liked kind of hearing that, because it just shows that our participants understand the risk that they are taking and the risk that comes with substance use. And so I think sometimes we can kind of get a little preachy towards people and maybe, using drugs isn't safe. And our participants know that, so that they acknowledge that they are taking a risk by using. They also mentioned things like safe injection sites, legalization, not using alone, and fentanyl test strips and Narcan, which are things that we do provide at our sites. They also mentioned like vending machines, which there is one currently, and we're working to have a few more in the county. You can go to the next slide too, Melanie, just to kind of further show when people were talking about the risk associated, that are the people that we interviewed do know that quitting is really the only kind of way to stay safe, particularly now with kind of all the different things that we're seeing in the drugs people are using. So you can see some of the quotes that people mentioned, that stopping altogether and using coping skills would be the best way to stay safe, and just wanting to quit, but acknowledging that it's really hard to quit, which I think we're really happy to kind of hear that from people and get their perspective on how to stay safe. Other things mentioned were some understanding from police, and so addressing stigma, which is another question we asked a little later. Things like vending machines, using with other people so that someone can make sure they're okay. Next slide. We also asked about ways to improve access to services. So the number one answer we got back was transportation being a barrier, which is something we hear pretty frequently from people. They also mentioned weekend availability, which I don't know if that's necessarily something that's feasible for us, and different hours and locations. So we have kind of looked at, like Destiny mentioned, expanding hours at certain locations, and our two busiest sites, we've found that sometimes there's like a line and people are kind of rushed. And so we have changed hours or expanded hours at those locations. Yes, Shauna.
Okay.
I told Shauna to jump in at any time. Yeah.
So a couple of things that I thought were super interesting with this information was that when we met with Dr. Fagan, so he's a medical director here for Hamilton County Public Health, what he saw is that these ways to improve access almost mirror the same kind of survey results that they receive around healthcare services, just around primary care, clinics. And so I just thought that was sort of an interesting way of looking at the information. When we talk about the weekend availability so transportation, that is still, and that's one of the things that, so the 5 sites that we have are spread across the county. Some of it is based on highest risk populations, that like data where we might have the highest overdose rates where we're placing our SAFE services. But then we also have other spaces just in terms of access. So like, we kind of have this east-west side of the county. And so how can we ensure that we're getting into all these other spaces? What I would love to highlight in terms around weekend availability is having Caracol and the partnership with Caracol and their vending machine, because certainly that is a 24/7, 7-day-a-week accessibility. We are looking to place 2 vending machines in the county as well. And so that is something that we are trying to increase, again, all around access, and just really looking at the data and using the resources so that we're sure that people can get what they need when they need it. Okay, I'll stop now.
Okay, you can go to the next slide, Melanie. Some additional just feedback about access. So transportation, again, like we mentioned, continues to be the biggest barrier. And I think something to notice that while a lot of our participants do live close to some of the sites that they come to, there are people that are coming from other states. So we have people that come from Kentucky, come from Indiana, maybe come from other counties if they're, in the area. And so if they don't have a ride or one of their friends isn't coming, it can be hard for them to get there. Next slide, please. We also asked our participants what they thought could be done to prevent overdose deaths. I remember just from asking this question that I think a lot of people were kind of like, oh, I don't really know, or didn't have a ton of just kind of like, oh, I don't know, how do you stop something like this? So 39% of interviewees that mentioned the supply of naloxone. So we do distribute naloxone at our SAFE services locations. And we do that by asking individuals if they need naloxone, rather if they would just want it, because we do know a lot of people come and they get it and then maybe they're not using it. And so they still have it at home. So we want to be mindful of our supply. And so asking if they need it. Also just education around how to use naloxone. So I know the people that are working, our staff that work on the truck and at the mobile sites will kind of like talk with people about how to use it, what to be looking for, making sure to kind of have that wait like 2 minutes or so before using another dose, so to give it actually time to work. And we recognize that in that situation, of course, they're going to be panicking. And so sometimes they're using multiple doses, but so we think it's important to continue the education around that. Also, not using alone. A lot of our participants will say that they know to use with somebody else, or they're using in groups anyway. And so someone can, use naloxone or call 911 if necessary. People also talked about using small amounts at first and going slow, knowing how to use fentanyl test strips, talking about like knowledge about the Good Samaritan law and things, because people sometimes are afraid of calling 911. And then they're not, they're running out of naloxone, or they don't know how to help their friend or whoever they're with, or whoever they're seeing overdose, and they don't want to get in trouble, so they're not calling 911 and then it's too late. Next slide. So we also asked our participants if they carry naloxone. So the majority of people that we interviewed said that they do carry naloxone most of the time. And they said it's because they have either used it on somebody or someone has used it on them. People also mentioned not wanting to their loved one to get a phone call that something has happened to them because there wasn't naloxone present. There also are people that mentioned that they don't use naloxone, which for us is a little bit concerning. The people that were saying why they don't carry it is because they only use by themselves, which raises a concern, because if something happens, there's no one there, to check on them, to try and help them. Or they'll say they are only using when they're at home, they're not using in the car, so they don't feel like they need to have it with them at all times. They also mentioned legal concerns, stigma, and also mentioning that they're not using heroin, which again is concerning because we know that there's fentanyl present in pretty much everything. So even if your drug of choice is not heroin, you still could be at risk for an opioid overdose. So those are kind of things that we're thinking about. How can we address some of those concerns? Because we don't want those people that don't carry naloxone to be at a risk of overdose. Next slide. These are just some quotes kind of around that. So people saying things like, I want to save lives, or I've lost my friends, and so I think it's stupid not to carry it, or thinking about my mom getting a call that I've died. And then for people who said that they're not carrying it, they said things like, it's hard to explain if you have it and you get stopped, the cops know that you have drugs. So again, bringing up the stigma piece, or not sure if it's legal. So thinking about the Good Samaritan law, or just knowledge of, are you allowed to carry naloxone? I only use it at home, so I don't carry it with me, or I keep it in my house for people who come over and overdose. So for those people who are not necessarily using, maybe in a public setting, saying that they don't carry it with them at all times. Next slide. One thing we asked, well, I've been having a lot of discussion since asking this question, are asking people when they've used naloxone and then kind of other steps that they've taken. So did they call 911, or what else did they do if they had to use naloxone? So most people said they have used it for family or friends, or a stranger. When we asked them if they call 911, people would say that they do. 43% said they do call 911. Some people said they call sometimes, and 39% said that they don't call at all. So for some of the reasons for that were that people were okay after they were, if they had naloxone with them and they used it, the person was fine. They didn't feel a need to call 911. That they felt like they could monitor the person themselves and they didn't need intervention from first responders. They were afraid of legal implications. So whether maybe they had drugs in the home, or they had a warrant or something, or just didn't want to have to deal with going to the emergency room and waiting or getting charged or anything like that. So we've done a lot of discussion since then of how do we get people to feel comfortable calling 911? How do we make sure that people are, receiving medical follow-up, and what other resources are out there for that? Next slide. We asked our participants about fentanyl. 100% of our participants said they know what fentanyl is. So we asked just a little bit more around if that's a drug that they seek out, and kind of their experiences with fentanyl. So 45% of our participants said that they do seek fentanyl as a drug of choice. A lot of people maybe weren't necessarily originally seeking out fentanyl, but they've kind of found that what else they're seeing on the street isn't as good as fentanyl, and they know that fentanyl is in everything. So whether or not they wanted to become addicted to fentanyl, like that's just kind of what happened because it's been in everything. And people do acknowledge that fentanyl is in pretty much every drug. So they know it's in their methamphetamines, in their pills, in cocaine. So there is that awareness of fentanyl and awareness of that they need to be a little safer because there is an elevated risk of overdose, and everyone is aware of that. Only 7% of our interviewees indicated that they test for fentanyl. So like I mentioned earlier, we do offer fentanyl test strips, but we've kind of found through doing these interviews that a lot of our participants aren't using the test strips to test because they just assume it's in there or they're hoping that it's in there. And so it doesn't really change their behavior in that way. Next slide. These are just some more quotes around fentanyl use. So for example, someone said it's the only thing you can use after you start using fentanyl. Once you get fentanyl, then it's what you're seeking out. It's stronger than heroin and it's cheap. It's hard to find heroin or any other substances that aren't mixed with fentanyl. People were saying just that they don't even think you can get just plain old heroin anymore, that everything seems to be something that's fentanyl and some other stuff. And so they're just, everyone that is actively kind of using and that comes to our sites knows that they're probably using fentanyl. Next slide. We were asking our participants about stigma and how it's impacted them. I think it's interesting because I know when I was doing some of the interviews, I don't know that everyone necessarily, when you first would say like, has stigma impacted you? I don't know if they knew necessarily what we were referring to. And I think everyone knows what stigma is, but maybe doesn't use the same terminology. So I would always just make sure to kind of explain what we were asking and what we meant by stigma. And 70% of the interviewees explicitly mentioned that it does impact them. And I would say people that said, oh no, it doesn't bother me, or I don't have any experience with that, as they continue to talk kind of through some of their experiences, some of them got emotional talking about how their substance use has affected their family, their relationship with the family and friends, or talked about instances that they've run into. So I think it really has affected pretty much everyone that we talked to, whether they explicitly said it or not, because it came out in other ways. So the number one person that they felt that stigma had impacted them was family and friends. So just changing those relationships, them not being able to kind of be around, or just the relationship changing through their substance use. They also mentioned healthcare as a pretty close second. And then employment and law enforcement were also mentioned. So we also asked about healthcare, and if people had like healthcare related questions, who would they ask? The number one answer was the internet, which I think is that's pretty much everyone. We're quick to go on our phone and Google what's wrong with us or what we should do if we have certain symptoms. Some people did mention like going to a primary care physician or going to urgent care. Some people said no one, which I think is too, it's just generally as people don't necessarily trust what they find out from health questions, or just avoid finding out what might be wrong with them. And we also asked how often people have gone to visit a doctor or medical facility. So some people said never. There's kind of a pretty even split. Some people did say they've gone more than 4 times or just 1 or 2 times, but people are going, but it seems like a lot of people don't have a primary care physician. And we're talking a little bit more about going to urgent care if they had like an issue that they needed to be addressed. Yes, Shauna.
Thank you. So I'm hoping, I don't think I'm repeating, but if I am, stop me. So when we were looking at the prior slide and then looking at this information, so like kind of the story, the narrative that we see is that, so healthcare was the second highest for feeling stigma, right? So this idea of shame or stories that people shared with us about like not being treated very well, whether it was in a clinic or an emergency room. And then if we flip to that current slide, these are still the people that they would trust in terms of getting good healthcare information. So to me, that was very startling just because it speaks to like here are professions and groups of people that I know they have good information, but I don't feel good about getting that like services and information from them. So, and we work with the healthcare, so, partners in our area as well. But I just thought that was just kind of looking at the connection of this information that, so as they're feeling stigma or they won't seek primary care, it's not because they don't believe that there isn't people with the skills and the knowledge to help them. And then of course, my favorite was the very first place was internet, because it made me think, isn't that all of us? Like, isn't our first question WebMD? But anyway, so just kind of normalizing some of this as well. So thank you, Darcy.
Thank you. Next slide, Melanie. So we also just kind of asked people how they heard about our services, and most people said friends or word of mouth. Because I think people just kind of know about our services and they tell other people about our services. And we have people that are updating kind of where we're at all the time. You can subscribe to our daily kind of reminder, like text reminders of where we're at, if we're closed, things like that. So I think there is a lot of information around where we are in the community. And this kind of just touches on what Shauna was saying about what information do you trust the most, what sources of information. And so number one was healthcare providers. And just again, what Shauna said, that people they feel the most stigma from healthcare providers, but they also trust them. And so if we can continue just to work on having those places where people can go and receive care and not feel judged, and have just continued education with healthcare providers, because it's so important for people that do want to seek help just for, routine medical care, on top of any other things they might be going through, to have people that they can go to because they do trust the information. Also word of mouth and family and friends, and social service providers. There were 17% that said no one or the internet. So I think a lot of people too, when we asked this question, didn't really have come up with 3 necessarily, because I think people are skeptical of things that they're reading on the internet now. So they'll maybe seek that information out, but it didn't seem like they trusted a lot of the things that they were hearing, and just kind of go based on the experiences of their friends and their family. Yeah. Next slide. So what have we kind of done with the information we've learned from this survey? We spent a lot of time this summer, so within our harm reduction subcommittee, going over the results. So we did a summer series where we kind of took a longer time to take a deep dive into the data, to the results we got, and what that means for our work, for what we can do together. So it was really great just to have kind of people at the table talking about like, hey, this is what our participants are saying. And we know that the people that we're seeing and our participants are also kind of seeing them maybe at like an emergency clinic, or if they go to Caracol, or different kind of people in the community that we work with. So we can kind of use this together to figure out what we can do, whether that's together or at our different kind of locations. Like Destiny mentioned a little earlier in the presentation, we do have the bags of short and long syringes. That's kind of one of those things that people have asked for, and it's just kind of, it was easier for us to just have, while we're making the bags, to just kind of throw in. And I think Sean and I talked about this a little earlier today, that sometimes we just make decisions based on the fact that it's easier for us to kind of do things a certain way. But so hearing so many people say, well, we would really like if we could have half and half, we made that decision to go back to doing that. We increased the hours at 2 of our locations, just because they are 2 of the busier sites. And we want to make sure that if people are traveling and are getting there on time, that they're able to be served. So I think from what Bobby has told us about the Safe Services team, is that extending the hours really has helped and cut down on that last minute kind of rush of a line at the very end. We've been doing a lot of continued education just in a variety of ways around naloxone. So we've been trying to branch out to different places. So we did something at the Avondale Business Center. We've been doing some work with universities and like college age students, continuing on the safe services sites to talk about how to correctly use naloxone. We're trying to work together with other people in the county that distribute naloxone just to see what we can do together to learn more about the way that other people are distributing, who they're distributing to, and just trying to look at, where maybe we're not distributing enough, or are there ways we can work together better so that we're not kind of duplicating the work, because we know that there's all kinds of people that are dealing with, shortages of staff, or just feeling like you want to be in a million places at once. We also talked a lot this summer about wound care and just like basic health care. So some of these things, just to say that not all of these things are direct necessarily results of us completing this survey, but I think it shows that these are things that are coming up from our participants, and the more we can kind of listen to what they're asking for and what they're saying is the need, and sharing that information with other providers and community partners, and maybe they're hearing those same things, and then we can all be like, okay, well, we're hearing this, you're hearing this, these are steps we can make to change. So some of these things might have been in the works already, but hearing that it continues to come up when we're asking our participants, I think shows that there really is a need, and that can kind of guide our work moving forward. So at Thursdays, we are at Caracol for the Safe Services site. And so they have opened up their clinic again to do some like just basic care, wound care for people that are coming to the site, because we have seen an increase in some really nasty abscesses with kind of some of the things that are in the substances right now. Am I missing anything? I think that's the big stuff. But again, we're just continuing to try and use this information to guide our work, and to see how we can take the feedback from our participants to make changes that are, helpful to them and beneficial to everybody in the community. Next slide. I think that's it, actually. I think that's questions.
Great, thank you so much, Darcy, Shauna, and Destiny. And I know we kind of went through the survey fairly quickly, so we will be sending out the slides afterwards so you can see more results. But if anyone has a particular question about a certain question and responses, I'm happy to go back and we can discuss it. So we do have several questions coming in the chat. Specifically around the basics of our Safe Services van, the syringe service program that we offer, what is provided at the Safe Services sites, and what do we have in the vending machine that's in existence, and then the one that we're about to put in place. So, Shauna,
I can give an overview of the Safe Services. So our Safe Services go, throughout Hamilton County. There are 5 locations, actually there are 5 locations, and we operate 5 days a week. The hours vary. So I mean, it's predominantly all in the afternoon. We do not have any, we have 2 evening sites, and then later afternoon. We also partner with some very specific nonprofit organizations to bring safe services to those locations that are not open to general public. For example, one of those partners is with an organization that provides kind of like day services for sex workers. So it's a place where people can go to do their laundry, take a shower, get something to eat. So it's kind of a respite space. And but they found that there were folks that could use harm reduction services. And so we partner with them and go there once a week to provide those services. But again, it's not open to the general public for that. But we do have 5 public sites. We serve between 275 and about 325 participants per week. We offer some of the very traditional, so like distribution of naloxone, fentanyl test strips, safe sex kits, first aid kits, personal hygiene items if we have access to them. We partner with and contract with testers for HIV and Hep C. So through the University of Cincinnati, through Caracol, and also with Equitas, in order to have those services available. Each of our locations, we have, so even though we're in a mobile van, so kind of a big RV, we have partnered with other nonprofits in our area to utilize their parking lot space in order to have our services in different neighborhoods. And some of those partners are MAT providers, outpatient services, primary care services. So we also look for opportunities to, if to do those warm handoffs, so that if somebody needs services that can be met in that way, that we have a way to do those kinds of immediate connections. Did that feel like a good overview, Melanie? You'll have to tell me if I'm answering the question or not.
Yeah. And we had quite a few questions just specifically about our policies around the van and locations and things like that. And have we ever come into any type of, how's our relationship with law enforcement, basically?
So I would have to say, I feel that, and these are great, I totally understand these questions from harm reduction perspective. So the mobile services came to the health department in 2018. Now, it existed 2 or 3 years prior to that. So I would say that we've had many things. One is the political will and the community champions for this work. So it has certainly made this work acceptable. And so we have good relationships with law enforcement, with the prosecutor's office, with county administration. So I know that, and that plays a huge role into our ability to be able to be out on the streets providing these services.
And did participants say that they were ever worried about leaving the van or going to it for their safety?
No, now we have had on an occasion, we have had some districts where they've seen officers that might be near, or, and this is over, that might be near our space, or they look as if they're like a patrol car might be near where we're also providing service. And it does make participants very anxious. So, I mean, I'm not gonna, and when we have those situations, we do what we can to reach out to just make sure that everyone, about what we're doing, being very transparent about what we provide, and really looking for opportunities to improve any of our relationships if they need it with our law enforcement partners.
Great, thank you. And somewhat similar, the type of naloxone that we provide, it's 4 milligrams, correct, versus 8?
Correct. And we have the name brand and we have the generic, and we are looking at intramuscular naloxone as well.
Great. And then how will people register or receive the naloxone from the vending machines, and how is that monitored?
So I can only speak to, I know Caracol has amazing information, and but I do not want to speak to their machine. I know that you can call a number, you can get registered, you're given a code for their vending machine, and then that's how you access the supplies. And I believe every 90 days you kind of like touch base again and register just to ensure that you can continue to use it. So it is low barrier, low threshold access. For our machines, we're very new in this process. And so we have not yet determined our registration process in terms of what we will distribute. We will be distributing naloxone, first aid kits, safe sex kits, fentanyl test strips, safe drug disposal bags is what will be in ours.
Great, thank you. And then I do think that there was a comment about what is done with the sharps kits and syringes that have been used. That was specific to the syringe service program too, Shauna.
So we collect used syringes, I mean, from participants, and we are tracking, like, as we, what we're distributing versus what we collect. We talk with people just to make sure that, because this is a bloodborne pathogen disease program. And so we want to be sure that it's safe for individuals and the community, and that we're properly disposing of used syringes. In terms of, we don't have a drop-off service for the general public. What we do have is we have an app, and on the app, there is a button that says found syringe. And you can hit that and provide us the location. If you find syringes, whether it's, we've had people, like maybe they've gone into a new apartment, or they've, in a park or in an alley, and, we will come out and properly dispose of those syringes.
And then does that kind of tie into the Good Samaritan law? So what is our Good Samaritan law in Hamilton County, basically?
I actually just have that up to them. So basically, the Good Samaritan law for Ohio, for the most part, unless you are on probation or on parole, it's really a Good Samaritan of forgiveness, right? That you're not going to be charged, or, if you're providing good faith, life-saving efforts for someone. So if you're distributing, giving someone naloxone. Now, the stipulations do not apply if you are on probation or on parole. However, I just read yesterday that a House bill has been introduced that would eliminate that criteria. In terms of that the Good Samaritan would be for anyone, regardless of whether they are on probation or parole.
Yeah, we'll be interested to see what happens with that. Thank you. So we have quite a few more questions. There was a question related to drug checking beyond fentanyl test strips, and do we all as staff talk with each other about the public health benefits of drug testing? So I'm not sure if that was specifically for the fentanyl test strips, or if there needs to be more clarification for that.
So I would say that that's an area of opportunity for us. That's, certainly we've done a lot to build our fentanyl test strip distribution, trying to get to as many at-risk populations as possible in order to have that available for folks. But we have not gone beyond that at this point. So that, again, it's an area of opportunity for us.
Yeah. Great. And then how do we plan on disseminating this survey information? Because it's really innovative in the sense of we're talking to the people on the ground in active use. So are we using this to inform any policies, or are we using this to better Hamilton County programs? I know we talked a little bit about it, but are we using this data further, and how are we disseminating it?
Darcy, I'm going to let you, because I know that you had started kind of the overview of this.
Yeah, so we disseminated all of our results to everyone that is on our harm reduction committee mailing list. And so we kind of briefly went over it at a meeting, and then with our full committee, and then we invited everyone from that committee to come through to our summer series. And so that's kind of where we talked a little bit more in depth. Outside of that, I don't think we've published it in any other way. We did one thing that came out of one of our meetings was disseminating that information to participants, because one of the questions, we didn't get any identifying information from people, but we did ask if they wanted to receive a copy of the results, that they could provide us with an email address or a phone number. So Destiny had gone back, and anyone that had an email sent kind of all the results in our PowerPoint that we put together. And then people that just left a phone number, she called everybody and asked if they wanted to receive that in a different way. So we did want the people that asked to see the results to have access to seeing it. And then I think it just continues to kind of guide what we're doing, and just thinking about what our participants' needs and wants. Because even like since then, we've done a mini kind of quick 5-minute just survey around like birth control and like reproductive supplies, and if that would be useful for people that come to our sites. And so just, I think we're really kind of leaning into getting information from the people that are actually using our services. And so from that survey, we've kind of, okay, is this going to be useful? And so we can continue to just have those conversations and use information that we're getting from the people that actually use the services and have the knowledge of what's going on in the community, and taking that, like things that people will say to our staff, whether it's like trends of what they're seeing on the streets or issues that they're having with certain substances, they're letting our staff know, and then our staff's using that information to see if other people are like seeing those same things, researching what the people are telling us, so that we can serve people in the best way.
Thanks, Darcy. And yeah, you touched on just the services that we provide. And I do think that our team has created a really great rapport with the participants. And I think a huge kudos goes out to Darcy and Destiny doing the surveys. And then also the team. We have 4 people, and then Bobby Turner is the head of the van. So I do think the relationships that have been made with everyone, that's also why we had such a great turnout with surveys.
Absolutely. We wouldn't have been able to, I think people wouldn't have been so eager to share with us. And I don't know that people would have shared as much information with us so openly, because there are times like when we have like had to help out if someone's sick, and we need to help out on the S.A.F.E services sites, but people don't really know us in the same way that they know the staff that are there every day. And so they were able to be like, hey, do you want to do this survey? Like we would sometimes do like set up in like the extra truck, and they're like, go over to the van and like go talk to Darcy. And like, they might not have done that if they didn't trust the people that are working and know that we're not going to use the information against them, or that we really just wanted to use this information to try and help and to make ourselves better and see what we could do better for them.
Yeah, I just wanted to reemphasize that, yeah, everyone's doing great work. And so we also did have a few more questions related to what is actually provided in the bags that we give. And I believe we answered that. We touched on it, syringes and other things. So
the only thing I would add there is our safe drug use kits. So that was that came out of COVID. Prior to COVID, our service had been a 1-to-1 exchange. And then when COVID came and we were looking for opportunities, always looking for those opportunities for better health outcomes, to do better, to address those, we moved to providing pre-packaged safe drug use kits, which have 70 syringes. And I just wanted to share this because this is kind of a continuation of our thinking as we do this work, because what we did is we asked participants of our services how many syringes they were using per day. And that is what brought us to 70, which meets, according to the folks that we talked to, and we tried to talk to every person that came that for like a week and ask that same question, that it met at least 75%, if not more, of the needs of someone's need for clean syringes in a week. Now, for those that were kind of outliers to that 70, there are no restrictions to our services. So, I mean, if someone needed more than 70, they certainly could come to our location 5 days a week or twice a week, in order to meet their needs. So so I mean, again, for me, I think it's so important that we're consistently asking participants and finding the best way that we can, meet what all the safety, health, and wellness goals and better health outcomes for really, it's not just for the individual, it's for all of us.
Yeah.
And then there was one more question. Were you going to ask it on, is the type of data being used to guide policy in Cincinnati or Hamilton County? Was that where you were going to go, Melanie?
Yep.
I would say, so as part of this, again, the harm reduction subcommittee is part of a much broader, county-wide coalition that has over 140 members, the different organizations throughout our county. So certainly we are bringing this data to the table. And so with stigma, with access, with our use of naloxone and how it's compared to the evidence-based practices, provided by CDC, are there areas of opportunity for partnerships, for education, whether it's with participants or ourselves. So I would say that, yes, I think this does guide policy, and it clearly has the ability to create change. So that, because we're always looking for those opportunities to be better.
Yeah, thanks, Shauna. And we have several questions asking about sharing the survey itself and the survey questions so that other communities can replicate it. I believe that's a yes.
I didn't, Darcy, I probably didn't. I was putting your email out there.
Yes.
So please connect with Darcy.
Yes, that's totally fine. We have like a PDF of the questions that we can send. Yeah.
Yep. As well.
Oh, thank you, Philip. He put it in the chat.
Yeah, as well as the recording too, because we've all gained a lot of information in real world, real life examples of what we can do to help our community and provide support for everyone. So I think this survey had a lot of impact, and it will continue to have impact for a while. So I think it's great. So I don't think we have any other questions.
Well, we do have one, and
Yeah.
I know we have one, like 1 minute left.
Yes.
And it looked like a couple of people asked this. Any discussions regarding a safe consumption site? So again, these are the kinds of, so for us, there is discussion, yes, but I do think that our community is, there's just a lot of varied opinions and a lot of varied conversations, and issues and concerns, and all valid stuff that we need to address as a community in order for us to be able to move in that kind of direction. And so that's where we are. It's not off the table, but it's not we are also not near a space of any kind of active planning. And to me, that just speaks to how important community partnership is. In terms of being able to have services available so that people, so again, and I would say, our mobile safe services, that the fact that we can go to all these different parts of the community and that we have the partnership and the leadership through law enforcement and county admin. And so, it's as we move to make changes and, better health outcomes for something like a safe consumption site, we really need the alignment and partnership of our community to make it happen best.
Well said, Shauna. Yeah, I do think that the partnerships that we've created throughout this survey, throughout our division, I think it's really helped everything in the community to make this program successful and to actually put some of these plans into practice. So with that, if we didn't get to all of your questions, then we will answer them via email afterwards. So please be on the lookout for a survey and also the recording afterwards, as well as the slides. So I just want to say thank you so much to our speakers. Thank you so much for attending, and have a great day.
And thank you, Melanie, for doing all of this to put this together.
Thank you.
Have a great day.